All right, so um, we're diving into the world of Clostridium difficile today.
Okay.
And I'm sure, as a medical microbiologist, you've encountered this little bug quite a bit.
Yes, many a time.
We've got some excerpts here from Gillespie and Hawkey's Principles and Practice of Clinical Bacteriology.
Yeah,
That's kind of like the Bible when it comes to C. diff.
it is. It's the go-to text.
And so today we're going to be unearthing some of the really important knowledge that you need to know in your day-to-day work.
Definitely. I think it'll be good to focus on the practical aspects today, but also, touch upon some of the more quirky things about C. diff
Yeah.
that make it a fascinating organism.
Okay, so first things first, let's just paint a picture of this bacterium.
Okay.
The book describes it as a gram-positive, spore-forming anaerobe.
Yeah.
But, and this is a fun fact, it often smells like horse or elephant manure.
Yes.
That's not a very nice smell in the lab.
It's very distinctive, and not in a good way.
Yeah, I can imagine.
You always know when you've got C. diff growing.
Yeah, but beyond the smell, those spores seem to be really important when you're trying to understand C. diff.
They are, yeah. I mean, they're incredibly resilient. They can survive in the environment for ages, which actually makes decontamination, a real problem.
That's F1.
Yeah. And then, of course, that all feeds into the transmission and the recurrent infections that we see.
The spores, Gillespie and Hawkey mentioned that the colonies fluoresce yellow-green under UV light.
Yes.
Now, is that always reliable?
So that's a good point. It can be a really helpful characteristic, but I wouldn't say it's, 100% reliable.
Oh, really?
The intensity of the fluorescence can vary depending on the media that you use to grow it.
Oh, okay.
So it might be a good initial sort of pointer, but I wouldn't use that as a sole means of identification.
Okay, good to know. Now, let's shift gears and talk about how C. diff actually causes disease. It seems to be a master at taking advantage of a disrupted gut microbiome.
It is. It's very good at that. I mean, it's an opportunist. It really thrives when that sort of normal balance of bacteria in the gut is thrown off.
Okay.
And that happens a lot with antibiotic use.
Yeah.
And that's where this whole concept of colonization resistance comes in.
Right.
Think of it as like a turf war going on in the gut. You've got all these good bacteria that normally keep C. diff in check.
Okay.
But when you wipe out all those friendly forces with antibiotics, it's open season for C. diff.
Oh, wow.
It can move in and really cause some havoc.
And once it gains a foothold, that's when the toxins A and B come into play, right?
Exactly.
The book really emphasizes their role in the disease process.
Yes. The toxins are the real bad guys here. They attack the lining of the gut, triggering inflammation and causing this whole cascade of symptoms.
Speaking of symptoms, what are the telltale signs that a medical microbiologist should be aware of?
So the classic picture is diarrhea. And as you might expect, given what we've already talked about with the organism itself, it's often very foul-smelling.
Yeah.
But what's interesting is it's rarely bloody.
Yeah.
So you might also see abdominal pain, fever, and the severity can vary hugely. So some patients might just have mild diarrhea that resolves on its own, but others can go on to develop really severe complications like pseudomembranous colitis.
Right.
Which, as you know, can be life-threatening.
Yeah, for sure. The book also mentions these AB+ strains.
Yes.
And these strains seem to challenge our understanding of how these toxins work.
They do.
They can cause disease even without producing functional toxin A. So how is that even possible?
Well, that's the million-dollar question, isn't it?
Right.
And researchers are still trying to unravel all of that. But the book does put forward some theories.
Okay.
So, for instance, some studies suggest that the toxin B produced by these strains might have a slightly different structure, or it might be able to target a broader range of cells, which would make it more potent.
Okay.
Or it might be able to compensate for the lack of toxin A. But I think the key takeaway here is that it has implications for how we diagnose these infections. If you're using a test that only picks up toxin A,
right,
you're going to miss these cases.
That's a critical point for sure. It highlights the need for us to be aware of these variations and make sure we're using diagnostic methods that can pick up both toxins.
Absolutely.
Yeah.
You really need to have all your bases covered to accurately manage these infections. And it kind of makes you wonder if there are other as yet undiscovered virulence factors that are playing a role.
Yeah.
And why certain strains are so successful.
Yeah, that's interesting. Speaking of successful strains, Gillespie and Hawkey talk about epidemic strains of C. diff.
Yes.
What makes them so good at spreading?
Well, there are a couple of theories. One thought is that they're just better at sporulation. So they produce more of those hardy spores that can survive in the environment and spread more easily. But the book also mentions that there could be other unknown virulence factors at play. It's like they've got a secret weapon that we haven't quite figured out yet.
That raises more questions than answers.
Yeah.
And it really underscores how much we still have to learn about C. diff.
Absolutely.
Now, let's delve into the lab diagnosis aspect a bit more.
Mm-hmm.
The book emphasizes the importance of toxin detection as the gold standard. Can you walk us through the different approaches and their pros and cons?
Sure. So we've got the classic cell cytotoxicity assay, which is very sensitive and specific,
Right.
but it can be time-consuming. So that involves actually exposing cell lines to the sample and looking for those characteristic cytopathic effects.
Okay.
And then we've got the enzyme immunoassays, or EIAs, which are much faster, but they might be a little bit less sensitive.
Okay.
And they work by detecting those specific toxins, A and B, in the sample.
Right.
So it's about choosing the right tool for the job, really.
And like we discussed before, it's really crucial to use a test that detects both toxins,
Yeah.
especially with those AB+ strains lurking out there.
Definitely. You don't want to miss those.
Gillespie and Hockey also mentioned C. diff culture. Where does that fit into the diagnostic picture?
So culture can be helpful, particularly for typing purposes.
Okay.
So helping you understand, what particular strain you're dealing with and its characteristics, which can be really useful for epidemiological investigations and things like that. But for routine diagnosis, it's not as practical as toxin detection.
Okay.
It takes longer. And it's not as specific for active infection.
Gotcha. So toxin detection is the go-to for diagnosis. Now, let's zoom out and look at the bigger picture of C. diff epidemiology.
Okay.
It seems this infection is becoming increasingly common,
It is.
particularly in certain settings.
Yeah, that's right. The book talks about that a lot. I mean, we're seeing a definite rise in the incidence of C. diff infection,
Yeah.
particularly in hospitalized elderly patients.
Ugh.
And that makes sense, doesn't it? I mean, they're often more vulnerable because of underlying health conditions, exposure to antibiotics.
Yeah.
And then you've got this added concern of the highly virulent strain, type 027,
Right.
which has been causing a lot of problems.
So for those of us working in hospitals, it's a bit of a double whammy then.
Yeah.
An aging patient population.
Yeah.
And these more aggressive strains emerging.
Absolutely.
The book also mentions the blurring lines between nosocomial and community-acquired infections. What's driving that trend?
Well, I think it's basically a reflection of how healthcare is delivered these days.
Okay.
You've got patients moving between hospitals, nursing homes, and the community.
Right.
And all that makes it much harder to pinpoint where someone actually picked up C. diff. Did they get it in the hospital and then get discharged to a nursing home and spread it there? Or was it the other way around?
Yeah. It becomes a bit of a detective game to track the source.
It does, yeah.
And then, of course, you've got the issue of environmental contamination.
Yeah.
Those resilient spores really make control a challenge.
Huge challenge. I mean, they can stick around on surfaces for a surprisingly long time.
Right.
So that's why decontamination efforts are just so important. And, this is where you guys, as medical microbiologists, play a crucial role in educating colleagues about those infection control measures.
Speaking of control, let's dive into prevention strategies.
Okay.
The book stresses the importance of judicious antibiotic use.
Yeah.
It seems almost counterintuitive, right? I mean, antibiotics are causing the problem in the first place, yet they're our main weapon against C. diff.
It is a bit of a catch-22, isn't it?
Yeah.
I think the key message is we need to use antibiotics wisely. Only when they're truly necessary. So that means making sure we're choosing the most appropriate antibiotic for the specific infection and avoiding those broad spectrum antibiotics whenever we can. Because every time we use an antibiotic, we're essentially, altering that gut microbiome, giving C. diff a chance to flourish.
Right.
The book also debunks this whole myth of using antibiotics prophylactically to prevent C. diff infection, because it simply doesn't work. And it can actually make things worse by further disrupting that gut flora.
So it's about minimizing collateral damage, so to speak. Are there any other promising prevention strategies on the horizon, like immunotherapy or vaccines?
So those are definitely areas of active research. The book does touch upon some of the challenges and the potential of these approaches.
Okay.
Vaccines are being looked at, but there are hurdles to overcome, particularly in making sure that they're effective in the elderly, who are, the most susceptible to C. diff.
It sounds like there's still a lot to learn.
A lot to learn.
But the research is definitely moving in some exciting directions.
Oh, absolutely, yeah.
Okay, let's move on to treatment. What are the go-to options for managing C. diff infection?
Okay. Well, first and foremost, if at all possible, you want to stop any antibiotics.
Right.
That might be contributing to the problem. That gives the gut flora a chance to recover.
Okay.
And reestablish that colonization resistance.
Right.
But if that's not enough, or if it's not feasible, the mainstay of treatment is antibiotics.
Okay.
Specifically, metronidazole and vancomycin.
So we're fighting fire with fire again.
Yeah, kind of, but it's important to understand the nuances here. So metronidazole is usually the first line choice.
Okay.
Because it's generally effective, less expensive, and has a lower risk of promoting resistance in other bacteria.
Right.
Like VRE, for example, vancomycin-resistant enterococci. However, vancomycin might be preferred in more severe cases, or if metronidazole just isn't working. And the book does a good job of comparing their effectiveness and potential downsides.
Gillespie and Hockey also address those frustrating recurrent infections.
Yes.
Why doesn't simply switching back and forth between metronidazole and vancomycin solve the problem?
Well, because often those recurrences aren't relapses with the same strain. They're actually new infections with different strains. So it's not that the bacteria have become resistant to the antibiotics. It's more that the patient's gut flora is just really vulnerable to reinfection.
So it's like a game of whack-a-mole. You knock down one strain, another one pops up.
Exactly. That's a good analogy.
Are there any other approaches being explored for these difficult cases?
Yeah, there are. The book mentions some promising new therapies like toxin-binding polymers, which basically mop up the toxins and stop them from doing more damage.
Oh, okay.
But these are still very much in the research phase at the moment.
It's fascinating to see how the treatment landscape is evolving.
Yeah, it's a really interesting field.
Now, let's talk about another interesting approach, biotherapy.
Okay.
The book highlights the use of live organisms, like certain yeasts or bacteria, to try and restore balance to the gut.
Yeah, biotherapy is all about harnessing the power of the microbiome to fight C. diff.
Right.
So the idea is you introduce these beneficial microbes that can compete with C. diff, either by, crowding it out or by producing substances that inhibit its growth. And one of the organisms mentioned in the book is Saccharomyces boulardii, a type of yeast.
Right.
And that seems to work by competing with C. diff for resources and potentially even binding to its toxins.
So it's like giving the gut a fighting chance to defend itself.
Exactly.
But are there any risks associated with using live organisms as a treatment?
Well, that's a good question. I mean, it's a valid concern, especially in patients who are immunocompromised.
Right.
There's always a slight risk that those organisms could actually cause harm, particularly if the gut lining is already damaged. So the book stresses the importance of careful patient selection and monitoring. It also points out that not all biotherapy options are equally effective.
Right.
So lactobacillus is another possibility. But the research on its effectiveness against C. diff has been a bit mixed.
So biotherapy is a promising avenue, but needs to be approached with caution. It seems like there are always trade-offs to consider when managing C. diff.
That's the nature of the beast, I guess.
Okay. Before we wrap up this deep dive, let's put your knowledge to the test with a few quick exam questions. Ready to flex those microbiologist muscles?
Hit me with them.
Okay, first question, get ready. A patient presents with severe diarrhea after a recent course of clindamycin. You culture C. diff from a stool sample, but the toxin AEIA test is negative.
Okay.
What's the most likely explanation?
So this is a really common scenario, and it can be a bit of a head scratcher if you're not aware of the different strains out there.
Right.
The most likely explanation is that the patient has a C. diff strain that's producing toxin B.
Okay.
But not toxin A.
Right.
One of those AB+ strains that we were talking about.
Right.
And those strains are still perfectly capable of causing disease.
Right.
But they won't be detected by a toxin A specific test.
So that's why it's crucial to use a test that detects both toxins.
Absolutely.
Yeah. You need to cover all your bases. Okay. Question number 2. What is the primary mechanism by which antibiotics predispose individuals to C. diff infection?
So this goes back to that concept of colonization resistance that we discussed earlier.
Right.
That normal gut flora is like a protective barrier against C. diff. And when antibiotics disrupt that balance, it creates an opportunity for C. diff to get a foothold and really take over.
Like wiping out the competition.
Exactly. Yeah. You're basically clearing the playing field for C. diff.
Okay. Question number 3. Why is the distinction between nosocomial and community-acquired C. diff infection becoming increasingly blurred?
I think that's mainly due to the changing landscape of healthcare. With patients moving more frequently between hospitals, nursing homes, the community.
Right.
It just makes it really difficult to pinpoint exactly where they picked up the infection.
It's a reminder that C. diff doesn't really respect boundaries.
No, it doesn't. It can pop up anywhere.
All right, question number 4. What are the 2 most commonly used antibiotics for treating C. diff infection?
Okay.
And what are their respective advantages and disadvantages?
So the 2 mainstays of treatment are metronidazole and vancomycin.
Right.
Metronidazole is often the first-line choice because it's generally effective, it's cheaper, and it has a lower risk of promoting resistance in other bacteria.
Right.
But vancomycin might be preferred in severe cases or if metronidazole isn't working.
Okay.
And as we mentioned before, each has its own pros and cons.
Right. It's about choosing the right tool for the job.
Exactly. You've got to weigh up the risks and benefits for each patient.
Okay. Last but not least, question number 5. Apart from judicious antibiotic use,
Right.
what is a key infection control measure to prevent the spread of C. diff in healthcare settings?
This one's pretty straightforward.
Okay.
Hand hygiene.
Of course.
Really crucial. I mean, those C. diff spores can survive on surfaces for ages. So, meticulous hand washing, using alcohol-based hand rubs, really important to break that chain of transmission.
You've aced those questions.
Well, I've had some good practice.
Now let's zoom out and connect this back to your role as a medical microbiologist. You're not just identifying and controlling C. diff.
No.
You're also educating colleagues on best practices to minimize its spread.
That's right. Yeah. I mean, it really is a team effort. We all need to be vigilant about identifying cases, reporting them, implementing those effective infection control measures, and just generally advocating for responsible antibiotic use.
Absolutely. We've covered a lot of ground today.
Yeah.
But here's a final thought-provoking question for you to ponder. Given the rise of antibiotic resistance and the limitations of current therapies, what novel strategies could we develop
Ooh, that's a good one.
to tackle C. diff in the future?
Well, that's a really interesting question. I mean, we've touched on some possibilities like immunotherapy, vaccines, but maybe there are even more innovative approaches out there waiting to be discovered. For example, could we develop targeted therapies that disrupt C. diff's virulence without harming the beneficial gut bacteria?
Yeah.
Or could we harness the power of phage therapy to specifically target and eliminate C. diff?
Interesting.
I think the possibilities are really exciting.
It's exciting to think about the future of C. diff research.
Definitely.
And who knows, maybe one of our listeners will be the one to make that groundbreaking discovery.
I wouldn't be surprised. There's always something new to learn in microbiology.
Well, on that note, we've reached the end of our deep dive into the world of Clostridium difficile. Hopefully you've gained some valuable insights and are feeling well-equipped to tackle this challenging pathogen.
It's been great talking to you today. I hope so.
Until next time, keep those minds curious and stay tuned for more deep dives into the fascinating world of science. All right, are you ready for the last question? Apart from judicious antibiotic use, what is a key infection control measure to prevent the spread of C. diff in healthcare settings?
Oh, this one's simple, but so important. Hand hygiene.
Hand hygiene, of course, yes.
Yeah. Those C. diff spores, I mean, they can linger on surfaces for such a long time. So really meticulous hand washing is key, or, using those alcohol-based hand rubs. Just really anything to break that chain of transmission.
Perfect. You aced all the questions. So now let's kind of zoom out again and connect this back to your role as a medical microbiologist. Yeah. You're not just identifying and controlling C. diff. You're also educating your colleagues on best practices to minimize its spread.
Right.
Definitely.
Exactly. Yeah. I mean, it's a team effort. We all need to be aware of these things. We need to be vigilant in identifying those cases, reporting them, putting those effective infection control measures in place, and really just advocating for the responsible use of antibiotics.
Absolutely. We've covered so much today, but I do have one final thought-provoking question for you to ponder.
Okay. I like a challenge.
Given the rise of antibiotic resistance and the limitations of some of the current therapies, what novel strategies could we develop to really tackle C. diff in the future?
Well, that's a great question. I mean, we've talked about a few possibilities like immunotherapy, vaccines.
Yeah.
But, who knows what's out there, what we haven't even thought of yet. I mean, could we develop A targeted therapy that disrupts the virulence mechanisms of C. diff without actually harming all the good bacteria.
Right.
Or how about harnessing the power of phage therapy to specifically target and eliminate C. diff? It's a really exciting area of research, I think.
Yeah, the possibilities are pretty fascinating when you think about it. Who knows, maybe one of our listeners will be the one to make that next groundbreaking discovery.
I wouldn't be surprised at all.
Well, on that note, I think we've reached the end of our deep dives into the world of Clostridium difficile. Hopefully you found this useful and you feel better equipped to tackle this challenging pathogen.
It's been great talking to you.
Until next time, keep those minds curious and stay tuned for more deep dives into the fascinating world of science.